Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on Fox News Talk 1020 AM. You also find us on FM 95.5. You can also live stream us online at foxnewskoan.com. That's foxnewskoan.com. If you have questions about your health today or questions about medicine in general, or as long as it's medical, it's fair game, give us a call here, 522-1020, 522-1020. As always, remind you how you find me during the week. You'll find me at my practice at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com, and that's DR for short for doctor, and Ellenburg, Ellenburg, so drellenburg.com. Check us out. You can see what we do at our clinic. And you can also find out more information from a number of different websites we suggest you should be looking at concerning your health, and some books you might want to be reading as well. And we also have some older archived radio shows, and I keep saying we'll get the newer ones on there, and that's kind of up to me, so I need to work harder at that, but please enjoy our site, drellenburg.com. I do see patients in the Kenai and Palmer areas monthly, and again, give our office a call at 563-2366 for times and dates. All right, what's on the docket today? We're going to talk about diabetes today. We're going to be talking about antibiotics specifically and resistance. And we're also going to be talking today about a very interesting study looking at hard calcified plaques in ancient populations. They did CAT scans on mummies. Very interesting. That's what we're talking about. And we'll also be talking today about ear infections in children for the most part. And last but not least, vitamin D. We'll see how that all fits together. But again, questions, comments about your health or about our topics, our number here at the station is 522-1020, 522-1020. Give me a call if you like. All right, let's get started. So last week, this is one I didn't get to that I wanted to get to, but I found a little more to add to it since last week, which is good. And that's talking about diabetes in the U.S. And there are two types of diabetes. There's type 1 and there's type 2. And certainly type 2 is one that we can definitely state that we can prevent, and we can typically get people, if they work hard at it, hopefully off medication, taking supplements, changing their diet, exercise, and getting off those drugs. Those drugs have a place when someone's having trouble with their blood sugar or really big troubles with the blood sugar. But long term, if you're a diabetic, you can change that. Type 2 is changeable. Type 1 is not. Type 1, you've had damage to your pancreas. You no longer secrete insulin like you need to, so you're on an insulin pump or insulin injections daily for life. And the biggest thing when I say about diabetes costs, we're really more or less at times focusing on type 2 because that's the biggest bulk of the cost overall here in the U.S. And there was an article that appeared at the American Diabetes Association site, or ADA site, that so the diagnosed diabetes cost to the U.S. for last year was $245 billion. And according to the report, we got approximately about 22 million people, which is about 7% of the U.S. population that have diabetes. And this number has increased 5 million since 2007. So it's quite a big jump once again. And we've got projected numbers that I've talked about before here on the show that could be upwards of 30 or 40 million people with diabetes in the next 10, 15 years. And it's an incredible cost. And in a sense, it is an epidemic. And that number of people who are being diagnosed with diabetes is taking place. And we've certainly discussed over the years here on the show what are causes of this? What happens? And a lot of it is lifestyle. A lot of it is poor diet, lack of exercise. But the other piece starting to show up, which is quite interesting with diabetes, is things called obesogens. And this appeared in an article that in Environmental Health Perspective is probably the best journal out there for environmental medicine. And this appeared probably about 8 or 9 months ago, and looking at a variety of chemicals themselves that are increasing people's chances of developing diabetes, type 2 specifically. And just because your mom or dad had diabetes type 2 doesn't mean you have to get it. It just means you are at increased risk of getting it, and you can keep it away by making proper changes. And this is a huge piece because we're talking about some cost here concerning diabetes here in the U.S. And as you know, we are having major troubles in running our country financially. And one of the big areas we have an outlay of costs is Medicare and Medicaid. And there certainly hasn't been any suggestions on how to revamp that system. But the reality is we have to get much better at not only the way we treat diabetes, type 1 and type 2, but also how we diagnose it and how we also prevent it in the populations that are around us, because we're going to be having increasing numbers of population-wise and increasing cost. And some numbers on here are quite interesting. So the annual health expenditures for someone with diabetes, either 1 or 2, that is type 1 or type 2, is 2.3 times greater than those without. So the average annual health expenditures for the average person who is healthy, not having any health complaints, typically is around $6,000 a year, where someone with diabetes is almost $14,000 a year. And a big portion of these costs of Medicare and Medicaid long-term, especially Medicare specifically, is having an older population that has diabetes. And, 1/3, this is reporting from Senator Susan Collins from Maine. She's co-chair in the U.S. Senate for a diabetes caucus that was held not long ago, and made a very interesting point that 1/3 of Americans older than 65 have been diagnosed with type 2 diabetes, and half are at risk for it. So that's a huge number. And as our population ages, and we certainly have many people moving in this bracket of age 65 and older who have diabetes who are going to fall under Medicare, it's a big issue in how we're going to afford to pay and help them out with their health care. And especially for a system they've paid money into their whole lives when they've worked, and they should be getting help with their health care, right? That's how it's supposed to be. You pay into a system, you should get something back from that system. But unfortunately, the reality is, along with many disease conditions taking place in the U.S. today, diabetes is far outstripping any health expenditure, probably in any category, concerning Medicare overall, because it's the biggest occurrence. And what I always find interesting is that we talk with patients who have diabetes, specifically type 2, again, we'll state that comment there, that they've been told by their provider, hey, listen, you're going to have this the rest of your life. This is how it is. Get used to it. And that's not the case. And, not that I want you to go watch a TV show or something, but, for a long time I've been a fan of The Biggest Loser on television. And, it's very interesting to watch people. Of course, they're getting all the help they could possibly ever need and get to try and lose weight and get in better health. But there's always a great episode on that particular TV series where they'll have them meet with a doctor, and he goes over where their health's at. And usually it's an extremely grim picture about where things are at and their health. And it's amazing when they tend to have a follow-up with the doctor down the road, where many people who come to the show with type 2 diabetes are able to stop taking their medications because they've gotten healthy. They don't need to be on the medications to manage their blood sugar. Their body can now do it on their own because they're in shape and they're eating well, and they cut out all the bad stuff they were eating, and they start exercising, and it changes things, and it can really help. And so exercise, whenever I talk on here about type 2 diabetes, or even type 1 for that matter, we suggest things like, over the years I've talked about chromium, vanadium, bitter melon, which is an herb that can be have great use within treating diabetes, berberine. We talk about those things with the thought that we know that the number one thing to be doing with diabetes, even 1 or 2, is what is somebody eating and are they exercising? Those are key components. And, whatever we discuss in the show to, callers, or we talk about conditions people have, I'm not always saying it, but I always mean number one thing being for treatment is your diet and do you exercise? Key points to keep in mind. With that in mind, there was a study that came out here very recently that looked at resistance training benefiting type 2 diabetics. We've known for a long time that aerobic exercise has benefited patients with type 2 diabetes in that it helps make so glucose in the body, blood sugar, is stored in 3 main areas. It's stored other places, but the 3 main areas in the body where it's stored is your liver, your fat, and your muscle cells. And insulin, the signal from insulin to those cells directly to store glucose becomes muddled, they can't transcribe it across, is when resistance starts taking place, and we start seeing people's fasting insulin levels go up, yet they may not have diabetes yet, but glucose control is an issue. And so with looking at resistance training or aerobic activity, we can begin to see some things we can actually add in for exercise. It can make a big difference in getting patients' blood sugar under control and helping them out. And in this study, they looked at basically the results are from, it's got a long name, graded resistance exercise and type 2 diabetes in older adults. Short name here was Great to Do. And this study was published online in Diabetes Care this month. And it was out of Australia, was the study was done at. And The biggest thing is looking at what are the benefits from exercise and what's being done. So right now, for the American Diabetic Association and the American College of combination of exercise that includes aerobic and resistance training. And resistance training, we're talking about, I'm not an exercise physiologist or something, but resistance training we're talking about is weightlifting in a sense of mild repetitions, multiple sets, with using weights. And the other part is aerobic. And so the part I like about this article is they make a very good point. And for a lot of people, for you to say, okay, well, let's start having you go out and start running or walking or riding the bike, is that so many of us, unfortunately, when we start exercising, for an intent, getting involved in maybe an intense regimen, is that we're so sore with the issue. I mean, our bodies are so sore from the exercise. And with resistance training, mild weights, we can begin to get people, even who are not in hardly any shape at all, involved in it quite quickly, along with aerobic. And this is important if if you have type 2 diabetes and you don't exercise, or if you have type 1 diabetes, you don't exercise, start doing it. It will help. Even in type 1, it will help. And in this particular study, they basically had 103 older adults with type 2 diabetes who were over the age of 60 years old and were put to 3 days per week of either supervised high-intensity progressive resistance training, so with weights, weight training with reps, or what they called, this is a funny one here, a sham group, which involved the same equipment but was low in intensity, slow, and did not progress. The people, when the study came in, and used the same amount of weight and intensity the whole way through for the number of months they were actually in it. And the people who were in the weight training were about 90 patients who were assessed at 12 months. And they had a much greater ability and improved insulin sensitivity in their bodies versus the group who was in, as they call it here, the sham exercise group. They also saw reductions in their hemoglobin A1C. And for those of you out there who aren't familiar with the type of testing for diabetes of any type, we typically like to have patients, and it depends on the provider, but once they get stabilized, it could be maybe once a year, but some patients even do it 3-4 times a year, and that's looking at what's called a hemoglobin A1C. And hemoglobin carried inside your red blood cells that carries oxygen. Well, some very smart researcher from Japan, almost two decades ago now, figured out that glucose reacts with various proteins in the body. And it's got kind of a funny name called glycosylation. But that's where glucose can react with proteins. In this case, it reacts with hemoglobin. And the neat thing about the hemoglobin A1C is it doesn't change but every 3 months. So it's more of a kind of a stable factor versus just taking blood sugar every day, fasting blood sugar. It means fasting from the previous night in the morning and seeing where somebody's at, because it has a lot of variation based on somebody's stress level and what they ate the previous day and those factors that are going to affect it, where the hemoglobin A1C isn't going to change from one day to the next. It can be a wonderful factor to have measured. In fact, if you're out there and say you're at least above the age of 40, or even 50 for that matter, and get some routine lab work done yearly, it wouldn't hurt to have a hemoglobin A1C done at least once a year to make sure that things look good. And that glucose, even though on paper looks nice over here, the longer term 3-month factor can really provide better information for you with this in the sense of hemoglobin A1C. So back to the study again, people who were involved in resistance training using weights had far better effects if they had progressive increases in exercise over a period of time, over 12 months, compared to those who did not. And so the bottom line is exercise, okay? Be it aerobic, be it the weight training, be it just walking. In my opinion, I'm sure we would find out that any type of exercise should benefit anyone with diabetes if they actually had the ability to actually exercise. And of course, there's many people who are unfortunately have diabetes or even type 1 or type 2 who are unable to exercise because of other factors involved. Their age or their mobility issues for sure can be involved and keep you from exercising. But for those that can, highly consider that. And if you have type 1 or type 2 diabetes and you don't exercise, start. You don't need to have a study to tell you to do it. But I do these things on the show here to tell you, hey, listen, they do work. Here's the evidence. That's what we're after here. All right, folks, we turn in today. This is Dr. Michael Ellenburg. It's my medical show here on Fox News Talk 1020 AM. We're also on FM 95.5, and you can also find us online and live stream us through your computer at foxnewskoan.com, foxnewskoan.com. And, of course, your questions or comments about today's show or about your health, it's a live call show. We do encourage your phone calls. Our number here is 522-1737, It's 522-1020. Okay, so that kind of covers up, that gets back to covering what I wanted to cover from last week as far as diabetes, and I added a piece about exercise. I've got probably enough time for the bottom of the hour break, which will be in about 8 minutes, but ran across a very interesting article on Medscape, which you can get online access yourself, and it's free. And it was entitled Atherosclerosis, that means hardening of the arteries, in 4 ancient populations, including hunter-gatherers. So in this study, which appeared in Lancet here this month and was presented at the American College of Cardiology this year recently, looked at CAT scans, or computed tomography, so CAT scans that were done on mummies from 4 different parts of the world across a period of 4,000 years to assess plaque buildup in their bodies. And they studied people from ancient Egypt, ancient Peru, ancestral Pueblans from the southwestern part of America, and hunter-gatherers from the Aleutian Islands here in Alaska. And they were able, in this study, to identify atherosclerosis or plaques in more than 1/3 of the mummified specimens, which is quite interesting. And they also chose people from a variety of places in the world with different habits as far as diets and lifestyles. And what they found is that there was a fair amount of cardiovascular disease in all the groups, even those who were hunter-gatherers, even those who were eating mostly fish. And it starts asking some deeper questions about, what really leads to causes of cardiovascular disease. I mean, the oldest studies were done on the Egyptians, and these are 3,500-year-old Egyptian mummies. And it just so happens that, was it in those guys? See, so in total they had 137 mummies, 76 Egyptian mummies, 51 Peruvian mummies, 5 ancestral Pueblo mummies, and 5 Unagan hunter-gatherers from Aleutian Islands. So not a whole lot from other areas, but the ones that get. And they had definite cardiovascular disease in the sense, definite hardening of the arteries, and about 1/3 of the mummies overall. So about 30 Egyptian mummies, 13 ancient Peruvians, and 2 of the Pueblans, and 3 of the Aleutian Island Native Americans. And it defined hardening the arteries by looking for calcified plaques in the wall of the arteries. And this is very interesting. I mean, you don't hear this very often. I mean, I know in the past I've seen an episode, I think somewhere on Egyptian stuff, where they were doing CAT scans of the mummy specifically to see what's actually underneath the mummified, the wrap they have on them, to look inside to see what's inside there, but never hearing much mention of this type of a thing taking place. One of the questions that is asked from the study is that, well, if we're seeing this level of, hardening the arteries, in this case, atherosclerosis, and as they put it here, 4 pre-industrial populations, we mean long ago populations, it remains today that we're still seeing a fair amount of cardiovascular disease. And the question is that, why is there more then than there is now? Or that's not really the case, but why is there a lot then and there's still a lot more now? So that's what I kind of meant to say, folks. And some suggestions come to bear, and one of the researchers brought up, well, a high level of infections would have increased somebody's inflammatory rates in their body, which may have promoted the more hardening the arteries throughout the body. And so many as I think if we did like a poll on the street and asked people and said, hey, listen, we're doing a poll on cardiovascular disease. What do you think is the biggest cause of cardiovascular disease? And what do you think people would say? They'd say cholesterol right off the bat. That's the first thing they'd say. And they'd say that because that's what's been hammered into our heads. That's what's hammered into our heads if you watch television or read magazines that have drug ads in them about, how's your cholesterol? How's your cholesterol? Because there's drugs that can actually treat that. Do you ever hear about things like C-reactive protein or homocysteine or fibrinogen? No, you don't hear about that on television because there's no drugs to treat those. And by the way, those are greater cardiovascular risk factors than cholesterol is. It's true. Cholesterol is a symptom. It is not a cause of cardiovascular disease. And I'm sure some people are rolling their eyes in this one. Well, the reality is if we're going to use models to describe things, let's describe the model that's currently agreed upon as atherogenesis. How do you get this plaque inside the wall of your artery? What really happens? What do we think happens? That's kind of more of the statement there. What's the model being thought of? So think about a nice little pipe, inside that being your arteries, and you got a muscle wall around that. But inside there, inside that pipe in your artery of yours, damage has to take place to the inside wall of the artery to allow cholesterol itself to get into the wall of the artery and then become a hard calcified plaque. Something has to damage that. And it's not cholesterol that damages that. How can we be so sure it's not cholesterol damage? Because cholesterol makes up, it's needed in those walls, in a sense. It's when things like small LDL, so we hear different comments about bad cholesterol, good cholesterol. Well, old cholesterol, in a sense, is good to some extent. It's a question of what type people have. And if you were to get a really harder look and a better look at the type of cholesterol in your body that maybe or could lead to a problem, you want to have an expanded lipid profile. That is a type of test that will give you more information about besides just doing a fasting general screen your lipids, which typically tends to only look at total cholesterol, triglycerides, LDL, and HDL. The question you want to ask yourself is, do I have good HDL? Are they the healthy type? Are they the ones that aren't as healthy? Do I have LDL that's healthy or negative? Do I have one LDL size that's so small? Because when that nick or that damage to the artery happens, it's when small types of LDL can get into the wall of the artery and get oxidized, gets changed chemically, and that leads to eventually a hard calcified plaque in that area, as we currently understand it. So don't forget that part, okay? So we think we know. What don't we know is really the question, right? Massive volumes of information, giant libraries of information is unknown, I'm sure, in medicine overall. But cholesterol is not the enemy. The enemy is what damages the inside of those arteries. That's the enemy, and that's the area we're looking at and trying to make changes at. And so I mentioned a few risk factors previously here a minute or two ago concerning cholesterol, outside of cholesterol, and that is C-reactive protein. It measures nonspecific inflammation. If you have a high inflammatory environment in your body, you increase your risk of developing cardiovascular disease. If you have very thick blood, so your blood doesn't move, it's too viscous. We're looking at things like fibrinogen, which is a marker of clotting in the body. And if it's high, you can take things, even natural things, to affect that. Homocysteine. Homocysteine is an amino acid produced in your body through a metabolism of something called methionine. But if homocysteine is around too long, you can also get damage inside of your arteries. And you can change that with B12, B6, and folic acid. We'll finish this part up and come back from our break. See you folks in about 5 minutes. Right back.
Take your baby by the hand and make her do a handstand. And take your baby by the heel and do the next thing that you feel. We were so in phase in a dance.
Hi there, folks. This is Dr. Ellenburg. Welcome back to the second half of our medical show here on Fox News Talk, 1020 AM, FM 95.5, and of course online at foxnews.com. If you got questions about your health today, it's a live call-in show. We do encourage your calls, 522-1020, 522-1020. Okay, well, let's talk about something that happens, or has probably happened over the years to many parents, and that is having a child that has an ear infection. And it can be a horrible experience as the person having an ear infection or a child having that in the first place, or dealing with a child who has it because they're in pain. We don't want to see our children in pain and be hurting. And so interesting guidelines have been put out from the American Academy of Pediatrics talking about how doctors should diagnose and how they should treat ear infections. And ear infections are quite common in children. And so every year we've got millions of parents who are taking children to the pediatrician for ear infections. And most of those children end up going home and taking antibiotics. In fact, as they point here, ear infections are one of the most common reasons kids see doctors and the main reason that kids get antibiotics, typically. Now, what's interesting, though, is some of the data here they present for us, and that is, you can say about 70% of children get better on their own within 2 to 3 days, and about 80% are better within 1 week to 10 days, meaning they never got any antibiotics, and they got better on their own. So that can be done. And the our today is, what are the downsides here? What are the issue of using antibiotics too frequently, especially in children? And what are some also other causes we at times see in children who have chronic ear infections? So one, if we're going to be using antibiotics often in a child, remember we've discussed in the show ad nauseum at times how much the antibiotics themselves, remember antibiotics kill bacteria. Okay, that's what they kill. They don't kill viruses, don't kill fungus, they kill bacteria. So you have all these bacteria in your GI tract. And some of the biggest reactions to antibiotics are intestinal because they are affecting your bacterial microbiome, we can use that word, in your GI tract. And they can cause upset, GI upset, allergic reactions. They can cause diarrhea because they're affecting the bacteria in your GI tract. And they can also increase the development of what we're calling superbugs, things that are almost hard to treat. In this day and age, where antibiotics have used at times have been overused, I certainly believe that being the case, and also the fact that you can be exposed to antibiotics from chickens, from beef. If they're treated with these things, you have antibiotics in the food supply specifically. They're even given to pigs, for example, not because it's good for you, it's so the pigs don't get diarrheal infections and can't be used and make a good healthy pig. So that they'll naturally put antibiotics in a lot of the feed for these feedlots. So the big exposure to these things long term. And you definitely, there's a time and a place for antibiotics, and of course I totally believe that, but it's use them in the proper way. And so one thing I talk about with an ear infection are a couple of some really home remedies that can make a big difference in children. And one, it's going to sound a bit odd, but I will describe it, that can be used for an acute ear infection in children. It doesn't involve them taking anything, but I call it, it's kind of the onion ear muff. It's been a nickname over the years, where basically you take an onion, a fresh one, you cut it in half. You could put it on a burner. This if you're not going to be eating it, so you can in a like a cast iron pot and heat it up. The best way to do is do it in the microwave, like for a good minute or so, and get it nice and hot, so the volatile oils are coming off and you can smell them. And then what the child does, it sounds pretty crazy, I know, is you wrap it in like a cheesecloth for them, because you don't put it next to the ear, it'll be hot and burn them. But we have had two family friends who've done this with their children with ear problems, having earaches, and the ear will just clear right up. And the pain goes away, and they go to bed, and a couple days later, the whole pain in the ear is gone. Just doing that. You can also, I know at several of the health food stores in the Anchorage area, get things like garlic mullein eardrops. Have been helpful in a lot of children over the years. I myself and a lot of children over the last several years we've seen for ear infections. Initially, because I can't prescribe antibiotics here in the state of Alaska, so I got to use what I have available to me. And so I have used garlic mullein eardrops. I've also used ozonated olive oil, which topically is very good for in bacterial, fungal, or even viral infections. And you can trap ozone in olive oil. Once you make it, make it kind of in a lab, you freeze it. And so freezing will keep that ozone trapped inside the olive oil. And so what the parent would do is buy some from us here and take a little piece off the top of it, like a little butter knife, and just slip it down the ear. So it kind of drains down the ear and kind of lays against that eardrum and gets absorbed across it, and it can be very helpful in treating ear infections. And in ear infections, technical name is called otitis media. And then if you have an external ear infection, it's called otitis externa. And I have treated external ear infections as well with the ozonated olive oil and had great results. So there's a wide variety of things to use. And the other thing that comes up quite a bit is, why is my child getting these ear infections over and over and over again, to the point sometimes actually the ENT will go in and actually put in tubes so it'll help equalize and help the inner ear, help drain the inner ear and get that stuff out of there more often than not. But before we get to that part, it certainly is worth in a child who has chronic ear infections to try them with no dairy for a period of time. Like, if you're getting chronic ear infections, like, several, or one a month or whatever it is, or it's again, they've been put on antibiotics each time, that's going to affect GI tract health down long term, and it can certainly affect the development of allergies as they get older or other problems associated with that. But a trial off of dairy, which I know for some people is really hard, can be done. It's difficult with a child because they have their lives going on, but if it's going to help out their ear infections, it certainly might. So consider a trial basis of a dairy elimination. I don't know. I haven't had a chance to really see if gluten makes a big difference or not with elimination for children ear infections, but I have seen dairy be the answer in a fair number of patients at times who had chronic ear infections. So there's more of a dietary piece for you. And, there's, a lot of reasons why ear can actually hurt. So it's important, too, that when your provider is checking the child's ear out, that it really and truly is an ear infection and not just the fact that, could be something different going on. They could be having trouble clearing their ear. They could have chronic sinus drainage from their sinuses that's affecting the way their inner ear drains, and that can also cause some ear pain as well. So it's important to have the proper diagnosis, of course. But the main thing being that if you can avoid it for your child, as long as it's at a point where it's safe and fever is reasonable, not some very super high fever, to have the watchful waiting. And if it's not clearing, the child could get on antibiotics. Like you get a prescription from your pediatrician for your child. If you need them, you get them. If you don't, you don't get them. So definitely would suggest if a child can hold off on antibiotics, see how it goes first and take care of the pain for a couple of days and see how that goes. If it doesn't clear up, then definitely antibiotics could be the way to go. And beyond all that, of course, is like using garlic marl ear drops, ozonate of olive oil in the ear, the onion technique, which can work as well. Again, that's cutting the onion in half, heat in the microwave, and put a cheesecloth so the volatile oils can get into the ear and help loosen up the membrane, so to speak. But some great ways you could actually treat those sort of things. And again, a reminder there on the dairy as being a possible cause of chronic ear infections in children. And certainly I've seen that as well. All right. If you turn on our show today, this is Dr. Michael Ellenburg. It's a medical show here on Fox News Talk, 1020 AM. We're on FM as well at 95.5 simulcast. And we're also online at foxnewsKOAN.com. And if you have questions about your health, questions about our topics, don't hesitate to call. I don't mind taking a break and talking to you about your health questions. Our number here at station is 522-1020, 522-1020. Well, let's talk about vitamin D. It's that time of the year where we're starting to get more daylight, and we're almost at the point in about a month and a bit more where if you actually, had some skin exposed to the sun, you actually would get vitamin D from it. And for those of you who don't know, is that during a majority of the year, because of how far north we are on the planet, Alaskans don't absorb any UVB rays, ultraviolet UVB rays from the sun to start the stimulation and process of vitamin D production in our bodies. If you are getting some of that, you're probably going to a tanning bed. But as far as the sun's concerned, you don't get hardly get none of that. Basically, from about September through so really, it's important to again remember when you hear that. Hey, listen, I probably should be taking vitamin D at a minimum, at least in the winter, if not all year. And I would recommend all year, but that's a matter of you having a lab test and see where you're starting from in the first place. But vitamin D, one of the best sites online still these days is vitamindcouncil.com. And that site's been created by Dr. John Cannell. And this month, in his newsletter, has a couple of different great little pieces here. And one specifically is looking at vitamin D deficiency and its association with severe adult asthma. And asthma in the U.S. Increased dramatically, starting in the 70s up through about the late 1990s, and it's kind of leveled off. However, in the world, as of 2011, there's almost 300 million people throughout the world who are affected by asthma, and results in about 250,000 deaths per year from asthma attacks. In the U.S., almost about 7 to 8% of the population has asthma. So it's a really big deal. I mean, that's like 26 million Americans. So that's a number of people being infected with asthma. And, there's a variety of environmental factors can be involved with asthma, obviously allergies, air pollution. There's a variety of other environmental pollutants that we can from areas we work in or from things we're, are in our own homes. And, we know that genetics is a little bit involved in making this happen because even identical twins, if one twin has it, they say here's about about 1/4 chance the other twin will also have it. However, we've also seen a number of studies, too, that because mom has it doesn't mean you're going to get it, but you're increased risk of getting it. And, I'm a big fan of patients taking probiotics, healthy bacteria for GI tract, and eating fermented foods, things like sauerkraut and kefir, or kimchi, for example, some different types of fermented type foods to help repopulate healthy bacteria in the gastrointestinal tract. And there's even a study done in Lancet, this is probably about 7 years ago, that looked at women who had a propensity to have dermatitis or asthma or just allergies in general, and they fed them probiotics while they had a child, while they were with child. And then after the child was born, the infant was given probiotics for 6 months. And then after that, they followed these children for almost up to 4 years to see what type of allergies they may or not develop. And they saw like a 40% reduction in asthma. It was one of the main things they found in the study. A 40% reduction in asthma in moms who already had asthma. It did not pass on to the child. And they're attributing that effect to the healthy bacteria in the GI tract. The GI tract bacteria modulates and is by far your biggest immune system organ in your body. So it's highly involved in this process. And what else is involved in this process? And getting back to vitamin D here, and that is they looked at vitamin D in this study, and looked at in the elderly study. So both they looked at first of all, some background data is important to bring up again too. He mentions here, as far as vitamin D goes for the elderly, hospitalizations and mortality, I mean dying from asthma, tends to increase from January to March in northern climates where we're at. And then the number of hospitalizations and mortality tends to take a decline beginning in April and through most of the summer. And so we kind of understand this, and this is a great little one here. In the U.S., a 10-degree poleward change in latitude from south to north is associated with a 2% increase in asthma occurrence in the population. So as you move away from the equator, say you start from Arizona, work your way up, each 10 degrees, so I think Seattle's at 37, so let's say, I think Arizona's probably like at 20, I think, maybe 22 latitude, and we're at, 60, 65 here, depending on what part of the state you're in. But as you go further north, increased asthma is happening. So quite interesting. And why is that a big deal? Because the lower you are closer towards the equator, you're going to have greater sun exposure throughout most of the year. And the way the tilt of the earth is going to be, you're going to get most of that vitamin D from the sun if you're going outside. Because I even have stories of people being deficient in vitamin D living in Arizona, if you could believe that. So it's really a big deal on how that vitamin D gets into us. And I mentioned earlier this UVB rays. Why is that a big deal? Well, UVB is what stimulates this to happen in your skin to begin vitamin D production in your body. And UVB rays are absorbed by the ozone layer in this part of the world, Alaska and Canada, for most of the year, a good 3/4 of it. So you're not getting vitamin D from the sun during those times. So in a paper that appeared in the Journal of Respiratory Research, and it was done in let's look here, Germany, they looked at severe and uncontrolled asthma and looking at vitamin D's involvement. And what they found is that both the control group, that means the ones who weren't receiving vitamin D, and then those that did, they had almost exactly the same median for their level of vitamin D. However, in the group who had asthma, lower levels were related to increased severity of their asthma, which is very interesting. And as we increased the amount of vitamin D over a period of time, people had less. And this particular study, too, they were trying to get a general idea of what are levels in asthmatic patients. And again, the lower they were, the more severe asthma they had. And as it increased, they found an improvement in asthma symptoms versus having bad symptoms. So the severity changed. And so the better level that somebody had vitamin D-wise in their body, if they had asthma, they had less severe asthma. So again, a reminder on vitamin D testing. It's important to understand. You need to have the test to have done for vitamin D. Blood test that I have done is a 25-hydroxy vitamin D. We see many patients throughout the year who come in right off the bat who are taking vitamin D, and hopefully, and many of them have seen other providers previously seen me, and I would say about half of them have had levels actually checked to see if they're actually on an adequate dose. Because just because someone's taking, say, for example, 2,000 international units a day of vitamin D doesn't mean it's the right dose. The RDA for vitamin D is 400 international units. That's so you don't develop the disease associated with the deficiency of vitamin D called rickets. that 400 international units is not for health, not for optimal health at all. It's for baseline, bare bones health. And so when someone's taking 2,000 IUs a day of vitamin D, for example, if they're starting off with a level that's somewhere around 25, it's not going to move very far. I mean, that dose, they might make it into the 30s. So that's something to really understand about how to take vitamin D and how the blood testing part can be extremely important. And it doesn't be too expensive either, because I know vitamin D test, I think at our office it's about $70 for a vitamin D test, and I think local place it's a lab that might charge cash is somewhere on the same number, maybe slightly lower, but it shouldn't be expensive to have your vitamin D levels checked. Just so you know, that's important. One thing I want to bring up, which I thought was interesting, concerning vitamin D, is its relations to cancer. And I spoke many times here in the show about prognosis in breast cancer patients and different types of cancers and their association with vitamin D. And they did a very interesting study that was done, where was this done at? Looking at lymphoma. It was in Australia. And it looked at patients who developed lymphoma, which is a certain type of cancer of your lymphatic system, and trying to look at the vitamin D levels. And so they got an idea is that, as the latitude changed for people who were closer towards the equator, there were less occurrences of lymphoma than those who were further away from the equator. So again, seeing some type of a connection between vitamin D and where your levels meet compared to, say, further away from the equator or closer to it. So this one here says, around 29 degrees south, because of course we're in the lower part of the hemisphere, represented the highest level of UV radiation in Australia, and the lowest part was around 37. So, and we're in the 60s, right? And they're having deficiency of vitamin D in Australia. Whew. So imagine that. So once again, really important to be, if you're an Alaskan, I would highly recommend you take vitamin D. And furthermore, get it tested. 25-hydroxy vitamin D is a test to do for that. Extremely important. Okay, one piece that I want to get back to today, actually, let's go to this piece here. We got time for this. Is talking about our cancer piece today. That was part of it, lymphoma here. But I made a big point, even with patients these days, and I see a fair number of cancer patients. And one thing that we hope to get them doing, if not already doing, they walk in the door to see us, is some type of exercise or physical activity. In fact, there's an article that appeared in the Journal of Clinical Oncology this month, talking about the associations between recreational physical activity and leisure time, and then looking at how that works out with people who have colon cancer and their survival rates. Interesting. I think it's interesting. And how does it pan out exactly? What are we seeing? I just lost my place here. Sorry, guys. And so they had to kind of measure it. What is physical activity? What is leisure time? And how much time is involved in this? And so what they did here, let me get back to where I was at. Sorry about that. Is they broke it down to these very strange categories, but they have a unit called metabolic equivalent hours. And so 3.5 MT hours equals 1 hour of walking per week. And then anybody who was from 3 to 8 hours was 1 to 2.5 hours a week of walking, and all the way up to somebody walking more than 3 hours in a week. And they also looked at the amount of time sitting still and the amount of time actually doing something. And so, not surprisingly in the study, increased activity, which meant somewhere around 3.5 hours per week of and that meant physical activity, was associated with increased survival. And we've been seeing that in several now studies have come out over the last couple of years looking at as literally a treatment for cancer patients, and increasing survival and decreasing side effects to chemotherapy and or radiation they may be receiving. So it's a big piece. And in people who were spending 6 or more hours a day of leisure time just kind of sitting still with less than 3 hours a week of any type of activity was associated with, of course, an increase in all-cause mortality, means an all-cause death from a variety of things. But again, sitting time and decreased activity levels are a known risk factor now for cancer. And we can change that. And that's kind of the reality, but about how we talk with cancer patients. This is milestone people come in. It's an opportunity in your life, even though it's a hard way to get that opportunity, to change things, to make change. Let's change how I'm living my life. Let's change how I'm dealing with stress. Let's change what I've been eating. Let's start exercising. These are things that are needed. And, of course, changing your diet. Definitely not eating eating whatever you want is not the diet to be on when you have cancer, unless you're eating very, very healthy things. When you're diagnosed with cancer, it's time to switch your diet to a pretty strict diet of vegetables and low protein and low amount of carbohydrates overall. You want to change the fuel. You want to take away the fuel source that's helping tumors grow in the body. And that's important. And at the same time, you also want to be doing exercise that's going to increase your immune system overall and make a big difference in the long run concerning your cancer therapy. And not just in colon cancer. We can use it in any type of cancer for that matter. We don't have to have a study that demonstrates it does something, but it sure is nice when we do have one. Let people know, hey, listen, here are things we're suggesting to do, and here's why, and we're seeing results. Here are the results in the patients. So it's important. So if any type of cancer, please consider physical activity as a therapy itself. And it is a therapy itself, for sure. That has a multitude of effects upon the body. All right, we got about 2 minutes left, I think, in today's show. Let's hit a few these little ones. There's a study that came out a couple years ago called Age-Related Eye Disease Study, or ARADS, and it was sponsored by the National Eye Institute. And it was quite interesting because it looked at age-related macular degeneration, where you basically have a change in the ability of your eye to focus from the macula inside the retina, and can lead to blindness, unfortunately. And so we're very interested from a nutritional point of view, how can we make a difference upon patients for them who may have age-related macular degeneration, or AMD. And in this particular study, it was a large control study. They looked at the combination of antioxidants such as vitamin C and vitamin E, beta-carotene, zinc, and even copper, and what kind of effect that would actually have upon eye health. And the other part they didn't add in here that they should have mentioned is flavonoids. And so flavonoids are found in a variety of things. Lots of fruits are found, and they're found lots of plants. And a more common type of flavonol that's found in food is quercetin, and is probably the most widely consumed flavonoid in the diet because it's found in apples and tea and onions and nuts and berries and so all kinds of things. And so quercetin is also can be used for patients who are receiving chemotherapy or radiation. Quercetin can be very helpful for side effects related to that as well. Let's get back to eye stuff though. So what is it doing in the sense of helping the eye out? And we know that it helps the lens out in the eye, specifically taking flavonoids through apples and tea, onions, nuts, berries, blueberries. So some great ways. So next week we'll get back into this next part of talking about eye health and ways of helping out with your foods. I do appreciate you people listening today out there. And thanks. Well, I didn't get calls today, but still thanks for listening. And I'm here on Mondays 2 to 3 p.m. And I'll talk to everybody next week. Bye-bye.
A folded hand of poker there. All new directions must go everywhere. Big round, big cool little square. Or you can't cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this